Welcome back to Health Coach Talk, and we have a great episode for you today. I am talking to Dr. Ravi, and we got to know each other during the pandemic, I believe. And I believe
That's right.
I think it was on Clubhouse when we were all on that app.
Well, that was a
So
big deal.
that was a very big deal and
Yeah.
great connections through Clubhouse. But now we're connecting on this podcast. And you had, before we started to record, you were talking about the fact that you were so glad that you are in health span and not health care. And I love that because that's what we're about as well. So, can you start off by talking about
Yeah.
what are the differences? What's the difference between a healthcare professional and being in the business of health span?
Yeah. First of all, thank you so much for having me on. I really appreciate it. It's always a pleasure to talk to you. You're kind of a thought leader in this field. So that's a great question. The funny thing is, after being in healthcare for so long, and this new word has popped up, and I think a lot of people have heard it around either podcasts or as they're popping up on their Instagram, like what is health span? So to me, health span, so healthcare is really good at like this number of things. Like when you get in a car accident and you got to put your bones back together, or, take out your appendix or deal with a very rare disease that requires specific medications, we're really good at that. Those things, or when you have an acute heart attack and need to put a stent in within 90 minutes, like it is amazing that within the United States, you can get the standard for doing that is 90 minutes from like when you have a heart attack at home to when like a cardiologist puts a stent in. That's like the standard. If you're not being that, you're not even like accredited. So that's amazing. A lot of science and a lot of technology and a lot of money has been put into that. But really, we have sick care, right? If you think about it, it's very reactive. We don't do what people really want. So to me, health span represents kind of three buckets of what people really want. And there are three things to us. So one is they want to prevent or reverse these chronic metabolic diseases, which are mostly preventable, and live longer well. The second bucket is we want to be better at work. Like we spend 90,000 hours of our lives at work, and it really matters to our health and our relationships and everything else. Third, and I think speaking of relationships, we all want to spend more time with the family and friends that we love and avoid burnout. And like healthcare does none of that. So everything I just mentioned, which is like what everyone wants ideally in their life, like healthcare doesn't do any of that. So we're like, well, what does do that, right? What is responsible for health span? How can we help with the right team, tools, and techniques together to do that? And that's what I've been working on. So it's like, let's shift. Imagine like the trajectory of our country, if most of us spent more time and effort on health span, like every day, or every week, every year, and what that would do to healthcare. So we reserve healthcare. We need those surgeons and those doctors and those immunologists for when those bad things happen or when bad luck happens. But instead of putting all of our money and time there, we go to health span and start focusing on improving ourselves, preventing these diseases, being better at work and knowing how to deal with stress and like nurturing our relationships, which are all really big predictors of longevity.
I love that. And that certainly aligns with what we do in health
Yeah.
coaching. In fact, I always use that example that, yes, if you are having a heart attack, you don't need a health coach. You don't need, at that point, even a functional medicine doctor to be telling you about herbs and supplements and specialized testing. No, you need to get to the best trauma center that's available to you
Right.
and the best of acute care medicine. But what
Right.
happens when you're discharged? Who is going to be helping you to address those lifestyle factors like diet and movement and sleep and stress and relationships
Right.
so that you don't land back in the hospital needing another procedure. And yeah,
Yeah.
there is our current system is not set up for that, which is why I'm so passionate about training health coaches. So you're so right. I mean, we put so much emphasis on the
Right.
doctor instead of on prevention and instead of looking at, you mentioned the word team sport, that this is a
Yeah.
team. Which again aligns with what we do, seeing the health coach as a key member of that medical care team. So, can
Yeah.
you talk about that team sport? What's your vision for that?
Yeah, I think so. There's something cultural here and also something kind of pragmatic that's led to this situation we're in, where we have like we kind of idolize MDs, don't we? Like someone walks in with the white coat with the MD after the name or the DO after the name, they're like, oh my gosh, whatever that person says must be right. Like, what if Dr. Oz says it, then it must be right. Because we do have a lot of training and we do have a lot of experience. Um, but I would say that I think we put them at the top of the pyramid when really this should be a level playing field instead of a pyramid in the beginning. And the reason is because, when I went to medical school, I started medical school in 2001. We did not have one single class on nutrition or exercise. We had one lecture on sleep, and it was more on like, just the science of sleep versus how to actually get people to sleep better and the kind of things and challenges people are facing or how to track it at home with where now that's changed a little bit. That is incorporated in the curriculum. But those things are not emphasized, even though they are part of the guidelines for most of these diseases that we're all suffering from, like diabetes and high blood pressure and lipid disorders and those things. So doctors are really good and they become even more and more specialized now, right? But what we have forgotten is that most of these diseases that most doctors are seeing seem like they're separate, but they're actually related. They're all in this like kind of category we call cardiometabolic, right? So insulin resistance and chronic inflammation is driving these causes that are creating things like cancer, dementia, heart disease, diabetes, obesity. So it's like we got to get to the root cause, and the root cause are these lifestyle areas. So 70% of this health span stuff we were talking about comes down these lifestyle areas that we're not trained in, right? And definitely difficult to convey over the average. I think the numbers were like the average visit length in America is like 15 minutes. And it takes about 15 seconds before when you go into that clinic, the doctor starts talking over you, right? And they're usually looking at like a computer screen and they're sitting there and they go, "Hey, you should eat better and sleep better, but I know you're not going to do it. So here's a pill," right? Like, and so they
Right.
know and they feel bad about it too. They want to spend that time. But they're just like, instead of forcing doctors and putting them in this situation where they have to do like all this stuff when the machine really doesn't allow them to, it's like, why don't you just pair yourself with people who are really good and they're trained or experts is just as well trained as you are, like dietitians and personal trainers and health coaches and executive coaches and life coaches. And they have their own expertise and training and experience, and they're really good at what they do. So it's like, hey, this is like more like a soccer game. You got to pass the ball to the people who are able to help those people when you can't. This is like it's like this is what I love about like how doctors who complain about like other fields or people or AI replace them. Like you can't complain when you can't be there in the first place, right? Like you can't. There's 525,500 minutes in a year, and you go to a doctor even for an hour a month, let's say, like your primary care to check in. That's still like 0.0001% of the time you spend. Like, who's helping you during the other minutes of the year, right? Where like all those health decisions are being made because they're being made at home and at work. It's like what you're going to eat that day for dinner. Are you going to train that morning or the next morning? So it's like you need a team that's going to be there for you most of those minutes. And doctors, it's like unrealistic to expect them to be able to pick up that load. So it's like, don't pick up that load. Don't stop playing racquetball, right? Like let's start playing soccer and like pass that ball off to these people. And I think give them the respect that they deserve. And we work as a team together. I think that's a much better way to do it.
It is such a better way. Not only is it better for those patients, but it's better for the doctor because they're so
Yeah.
stressed and overworked and burnt out. When you have a team, they lighten the load. But it's also, I think, going to address the serious problems that we're facing that will get worse, which is the growing doctor shortage, particularly in primary care. And good luck finding a new primary care doctor. They're retiring in droves. New doctors aren't choosing primary care, they're choosing specialties like orthopedic surgery and dermatology, for example. They don't want to go into primary care. And the olden days, I read about this in my new book, which is you had a doctor, you had an old fashioned family doctor. He knew you, he knew your family, he looked you
Right.
in the eye. They had bedside manner, which has disappeared. But when you have a team, those people on the team, like the health coaches, like the personal
Yeah.
trainers, they will connect with you and address those crucial lifestyle factors. Therefore, you are lowering healthcare costs because then you're
Yeah.
not saying we don't need doctors. We both agree we do for those
Yeah.
acute care situations. So they are then practicing at the top of their license. The medical detectives making
That's
the
right.
diagnosis, doing their specialty for acute care because they're not trained to deal with the chronic
Yeah.
conditions that are an epidemic.
Oh, it's interesting to see how like our life coaches, our health coaches on my team, and like our executive coaches as well, they know way more about that stuff than I do, right? On how to not just knowledge that is intrinsic to the field, but how to apply it and translate it to that specific person to kind of say what they need to hear and the specific steps to personalize that approach. And that would just take a lot of time, and nor am I trained in that. So it's sometimes a lot of the solving these problems with health is like finding who can do it versus like how to do it yourself. It's like find the right people. And I think putting that integration and that's what's referring to, those are cultural things that's happening. That's that cultural shift, which I've noticed during COVID. It was we've talked over the years. People are much. There used to be this kind of thing. Well, it's like doctors would, in their mind, you start getting jaded a little bit. It's like so you can see some primary care doctors. They're like, I'm going to tell you that you should lose some weight and you should go exercise 150 minutes a week, and all these guidelines they'll spit out at you, and they'll say, well, I just don't think you're going to do it. Like, so there's just no trust that you can execute on that. So it's like, I've got a couple minutes here. What's the best thing I could do for this patient is at least get them on something. Here's your Ozempic. And so I'm worried that we start blowing Ozempic, blow darts at everybody, and then use that as a substitute for building that base of the pyramid, which is what we really should be doing, is using it as an augmented tool to supplement a better psychological approach to food, how to train, how to like rearrange our days so we can like sleep correctly. And then you put on the Ozempic, and then you have, the top. So this kind of this, I think it's probably just from a tribal human thing where like there's always like that family doctor you talked about. It's like there's always been that shaman kind of figure, right? In every tribe, every group. And there's nothing wrong with that. It's just there's more to that in our culture. I think we have to see this cultural shift where people are finding these other experts to get answers to these problems. So it's just like trying to integrate those two has been challenging but very fruitful.
Mhm. You've always been a visionary and look towards future solutions and a big advocate of digital healthcare.
Yeah,
And we're seeing an explosion of direct to consumer lab
yeah,
testing, better and better devices that so we
yeah,
can be our own CEOs of our own health. We can be monitoring. We can do our continuous glucose monitor, and we've got
right,
our Apple Watch and our Aura Ring and other devices and these are just going to get more and more sophisticated. And our
yeah,
consultations, just as we are meeting right now virtually, not face to face, but
right,
this all can be done without fear from the comfort of your own home. So can you comment on that and what you see as the
yeah.
future of health span care?
Yeah, so I think I agree with you, and just seeing this incredible and being part of this revolution in digital health, is my background, helping kind of design and develop some of these devices and to see what they can do, what they're capable of is absolutely amazing. So things that would cost the ICU level diagnostics or a EKG machine that would cost $15,000, you can get for $200 on Amazon. It fits in your wallet, right? It's amazing that we can do that. So we're going to see a progression of these devices getting better and more accurate, more validated, and used as part of these kind of more integrative health functional programs, like what our company does. And we do use those things. So I see things like Levels, and we use like Levels, for example, and they're doing an amazing job in a continuous glucose monitoring solution they have with Dexcom to give people insight into how what they eat affects their metabolism. If you want to scare the crap out of most people, though, put them on Levels for 3 months and not give them any guidance, right? It's like what I
Exactly.
see
Yeah.
is this like it's like we can get into this. We're really good at developing this. We've developed this like information multi-omics platforms that you can just pay money and get all your labs. And what I see, and a lot of times is people go, okay, that's great. I want to know about myself, unlock some insight about my body and where it is and how it's doing. And then you pay a lot of money and you get all this data. But I think the trap we could fall into here is to think that like most people, the data alone is going to change their behavior. I think for 5% of people, especially people like me who start these companies, right? Who start or who are the heads of, we always think like everyone's like us, like, oh, if I had that data, then I'd be able to like go, if I get a smart scale, well, then I'm going to go run more because I want to lose weight. I want to see that number go down. And that should be true, but there's that intention action gap, right? Where we have this intention, we just can't seem to, 5% of people are able to do that. 90% of people I think aren't. I think, and I would include myself in this 90. I need my health coach. I need my personal trainer. I need that personalized accountability partner who can help keep me motivated, who can help kind of combat those negative voices in my head. We all do these things. We talk ourselves out of the right thing to do, right? So there's a lot of behavior change techniques that we use to combat that. It's just really hard to do alone. So the trap we could fall into is thinking just more data, like give more data, more accurate devices, more reminders and instructions from your Apple Watch. I think if we do that, you're just going to see people what's happening now, which is people just turn those notifications off. So it's like when we use levels and we have one of our dietitians guiding our clients with levels, that is an amazing combination. So it's like, okay, now we know what these 10 gummy bears, I use that example because it's like my cheating food is gummy bears and Reese's peanut butter cups. And like I test out levels. I love them, by the way. I love their leadership as well and what they're doing. I was like, oh my gosh, I didn't know this was making such a huge difference to my metabolism. So it was insightful, but I'm
Yeah.
really trained as a physician and I run a health longevity company. So you would imagine for me, I know what I'm looking for, what to do. But for a lot of people, it's like data alone for most people is even as accurate as it could be, I think is not going to be enough. I think we need to pair it with kind of a psychological or cognitive behavioral coaching model that can help coach people. Okay, now you have this information. What do we do with it? And how do we stick with these steps? The next steps you have to take, and how do I convince you or persuade you or empower you to take these steps so you start getting more self-efficacy? This is the thing that what we've noticed, which was a little bit of a surprise to me, after just been coaching people for a couple of years now with a team, and it's the metric that matters the most. I wonder what you think about this. Is what we've noticed is this sense of self-efficacy or agency. People feel like when they come to us, they're like the 55-year-old male, hard charging executive or busy professional, and they're in control at work and they're in control of everything and they're doing really well and they're successful and they've got everything they want in terms of finances and all that stuff. And but they feel like they're out of control with their health. Like they feel like they're always behind the ball. And it's so overwhelming to figure out all the stuff in the marketplace and what works and what's true and is all those things that they don't even know where to start. So it's like what we've noticed is after 6 months of coaching with various coaching types and modalities, they feel like they're more in control. They feel like they are on top of it. And I think that is what is the driver of the momentum for them to sustain the changes they're making and continue to seek more changes. And that bleeds over to everything else in their life too. Have you noticed that? It's
Yes,
it's the
a
metric. It's the
thousand
metric that we don't.
percent. Mhm.
Yeah, it's the metric we don't measure
Yep,
very. We
that's
started
right.
measuring it through kind of psychological testing, but it's something that you can't get a blood test for, right? It's
Yes.
like you just need people. You really need to just interact with people to understand kind of where their headspace is there.
You are spot on. And in a review of the research on the benefits of health coaching, why does it work? I cannot tell you how many studies come to the conclusion that what changed was increases in self efficacy. There's a stronger sense that I'm in control of my health, my destiny, that I can
Yeah,
take charge. And it's a feeling of empowerment. It's a feeling like I matter and
yeah,
I can make the decisions. I'm in charge. I don't have to just swallow whole what the expert, the doctor, for example, is telling me. I can
yeah,
look at these choices and I can decide, but it is overwhelming. And that's where the coach, a guide comes in who can help them sort out the research, sort out often confusing information that might be out there. But absolutely, at the end of the day, it's the sense that I matter, self efficacy. And I can't tell you how many studies I have reviewed that is the main conclusion. And from there, they have that aha moment like, yes, I'm ready to change. I can do this. I can start small and I can start to move every day. I can start resistance training, whatever it might be that they would like to do to have a better health status. And it is that self-efficacy, and we found it in our own research as well. Very, very key. And I love what you said that yes, there's so much data coming out, and even from wearables, you could tune it out and it can be overwhelming. And now there's this huge push for AI health coaches. Almost every day there's another one. Apple, Samsung, they've all Google Quartz, they've all got one. OpenAI will have one with Thrive Global, and my understanding is they're not really coaches because what they are doing is providing advice, tips, but you turn that off. It can be annoying. For
That
example, when
yeah,
I have a bike that is programmed with AI and it'll have a breathing pacer and it'll give encouraging interruptions in what I'm doing, and
yeah.
these little feedback loops and I just like, I don't even look at it. I just turn it off. And so I think that's what people will do. They will turn it off. And it is not that basic heart centered communication when you have a real human being who
Yeah.
is guiding you.
That is so true, and I think, we are also developing an AI model to help us just get the cost down so we can democratize health span to more people. I think it like, health coaching and health coaching teams or precision medicine, I think kind of this precision medicine, precision lifestyle coaching combination. The future for me is like when you buy an iPhone, you don't pay extra for Siri. You just get it. It should just come with your phone. Why doesn't that work? Like, why don't we have that for like health coaching, like steering? Imagine like a 16-year-old, whenever they get their phones these days, I don't know, but like their first like on smartphone day one, it should automatically come with these services installed to start steering people down the right directions, the right decision making, right thinking patterns from day one, and not wait till they're 50 to get their heart attack. And I also agree with you. I actually wrote a big piece on LinkedIn on this and on Twitter saying just that and kind of how our AI model is a little bit different than those just like small reminders. Because reminders, you'll just turn them off. I mean, the abandonment rate of digital health products is 70%, I think 70 to 75% over 3 months. So it all sounds good, but after a while, you don't want to get nagged anymore. You want to be kind of, I tell people who are prospective clients at Daytona, sometimes I tell them like, yep, sometimes our coaches are going to emotionally blackmail you. Like I'm just telling you right now. I'm just start laughing. I'm like, no, it's true. And I talked to them 3 months later. They're like, yeah, it does work, right? It's like they know how to reach me in a way where we're not looking for. I know it's perfect. We're not looking for 100% adherence to every single recommendation, but you just have to make more good decisions than not for your health, and you will start seeing a difference. And then we start building the self efficacy and things like that. But it has to be emotionally resonant. And we've had this discussion in the company a couple times where can we ever just replace the human completely? And we decided no. I mean, I think I strongly, and this is just my personal opinion. I think there's some people that will really respond to just having a bot or ChatGPT version 7 that is so good that they're like, that's all I need. But I think we should use AI to connect people and not isolate them. And so I think having a human in the loop makes a huge difference. Like nothing is as good as just like even a Zoom call with somebody, right? Or having coffee with them. Like, how are you doing? That doesn't seem to be replicable. Using just AI because you're fighting against 300,000 years of hominid evolution, right? Where we're just designed to interact that way. So I think it can be a great tool, and we're going to use it as a tool, these LLMs, for example, and to make that. But I'd rather pitch it to people who are saying, look, there's going to be a team that's going to look after you. This team is going to be like some in vivo and some are going to be in silico. And that's okay. And they're going to work together. All you have to worry about is we'll never lie to you and try to trick you to thinking this bot is a person, and that like both are going to both care about you, and they're both are like looking out for your best interest. So it's like figuring out what that combination is going to be is something that no one actually knows exactly, right? Like, but this is like still such a new field. We'll see kind of which combinations work, and we're excited to be part of that push. So we'll see where everyone ends up there. But
Yeah. Yeah, and it is definitely that merger. So it's not either or because there are wonderful things that can happen as a result of the power of AI and precision diagnostics, for example.
yeah,
And if you want some general information about your health status, or you can get some direct to consumer lab testing, and the
yeah,
more AI is available, then they can have reports that are tailored to you, that are much
yeah,
better than, for example, any given doctor can do, and that's what I have heard is a very good use of it, and
yeah,
so many ways that, people can get information from AI,
yeah,
but the health coach, the human health coach can sit down with them and help them sort out where do they wanna begin, how now given the information that they may have access to as a result of AI, what are they gonna do with it? Where do they want to start? What works for them? What are some of the obstacles that may get in their way? And in groups. So that's the other thing that AI can never do, and that is
Yeah.
Getting people together in groups where often the community becomes the medicine, so to speak, and change can really happen. So helping people with that model as well.
You bring up a really interesting point, which is in a lot. It kind of dovetails to this much larger question about like what is the human role in AI going forward. And I think what you said, if I could restate it, I've been thinking about this a little bit in kind of there's kind of two points here, right? Which is like answer finding and question finding.
Mhm.
And we always kind of ignore question finding, even though in science it's really hard. No one really teaches you how to do it. And health coaches, a lot of times, are not just answer finding is what these AI systems will always beat us at. Like, what is the best treatment for chronic UTIs in people over 50 or something, whatever. It's getting to the point where it's like not using perplexity.ai or something to solve that problem is almost malpractice, like because it can read 1,000 more papers than you can. And so that answer finding is great. Like, help me interpret these lab tests to see what's wrong with me. But it's like takes the human coach to the question finding. Question finding is messy. It takes a lot of thought and experience. There's an art to it that's hard to explain. This intuition with like coaches and other people that have been doing it for a while. And those systems aren't really good at that question finding. So like when you have a client or a patient who's been doing well and then has a week that's just, you can tell is just off. Their data, on their Oura Ring or Fitbit, that they're moving less. They seem a little more despondent. It's like the coach being able to know what questions to ask and when to ask them and how to ask them, I think is something very difficult for AI systems to figure out. I think that's where humans really shine, which is, I think, where they fit into this kind of larger future of AI and humans in general.
Absolutely, those subtle nuances, the question asking, and that is something that can really help people to evaluate and have that aha moment where now they're going to commit, where they have assessed what really matters to them. They've determined that, and they're ready to go forward because of that human relationship. Also, I've had
Yeah.
many people say they're working with a health coach, and they'll think, "Oh, I was about to open that bag of Oreos, but I heard the coach's voice in my head, or I knew I had to have that encounter." Well, that's a human to human connection. If it was somebody who is not real, a bot, I don't know if that would be, they would have that level of
Yeah.
accountability if it's not a
Yeah.
real person. Just like if I'm working out with a system now that is AI based, and I'll get corrections like, "Oh, on that last rep, lower the weight slower." Okay, well,
Yeah.
if I do it, I mean, I'm doing it because I'm making that decision, but it's not because there's somebody in front of me and I want to please
Yeah.
them.
Yeah, it's gonna
Yeah,
have to be through like, yes, the only way we can automate it is you use punishment, right? Which we use very rarely. But
right.
do you know there used to be a wearable that did that? It was called Zap. And
Yes, I
do you remember
remember that. Yeah.
I bought it for our office in our previous startup. It and it was hilarious. And it would it would electrocute you. So
Oh,
think of like a Fitbit, and but you'd have to, when you did something that you didn't want, it didn't want you to do, it would literally electrocute you.
oh,
It's like, I don't
wow.
think that's the society we want to live in. I think it's like
No.
empowering people to make those decisions, not punishing them. But
Yes.
yeah,
Yeah,
so that's
yeah.
that's
So at
amazing.
the end of the day, we're talking about behavior change and how do you really help people change when, as we've talked about that, there is that intention behavior gap, which
Yeah.
is you wake up, yeah, I'm going to do it. And then you have the good intention and then you don't follow through. And how do you help people have that motivation to
Yeah.
follow through and what goes through their head and their heart as
Yeah.
well, that I'm gonna
Yeah.
do it because it feels good or, or they connect with that big why, what they want their health for.
Yeah, that big why is a big deal for us. What we've noticed is we call them captivators. A captivating is a
Mhm.
bad portmanteau of captivating motivator. Finding out that why, and we will say, well, I'm going to lose weight. I'm like, okay, why? And you're like, well, I want to look better. I'm like, why? Well, I want to go to this wedding soon, and I want to look like, who are you trying to impress? And we'll just keep going down this line of questioning, and then you'll find these really emotional reasons. And when you open up and you're building rapport as you do this, without those whys, it's really hard to know kind of like, to be when you remind people of those whys, they go, "Oh, I get it. I can visualize this now." And there's been a lot of data on this in papers as well, as you know, about kind of visualizing your future self and understanding kind of these deep
Mm.
motivating factors. So that's one part of it. And there's a lot of these behavior change techniques that they can be used, and everyone is so different. Knowing which ones to match with different people is really important. So some people are very collaborative and they want to know, they don't want to be compared to somebody else. They want to like feel like they're inspired by another person that they admire, or want to work out with people in a social group, for example, or other people are very competitive and they kind of thrive off each other, on that way. So knowing those differences makes a big difference. So kind of those behavior change techniques kind of end up being bottled into like these kind of categories, right? So one of these like social pressure and like kind of doing things in groups and like utilizing the power of other people. The other one is kind of, I know no one likes to hear about this, but it is something that has to be cultivated, which is willpower. So like developing willpower and intention. So like doing things with intention, so that if you want to go to that McDonald's, it's up to you, but just make sure it's an intentional choice and not an impulsive choice. So like that just takes training, and there's several other buckets as well. So habits are one that get talked about commonly, but the paper out of Duke that came out a while ago that talked about how habits really only account for 40% of what we do, right? It's habits are about automaticity. Like, it's not, there's no intention there. It should just be something that you just do. And it's not, habits aren't everything, but they're a great thing to always cultivate and create. And there's a couple more of these buckets as well, like environment, like engineering your environment differently, right? So like putting that thing of M&Ms in a opaque container versus a clear container, these small things start mattering. And when you start implementing them all, and you can see like, oh, okay, like they start making these changes. Like it kind of starts to click. We've noticed it takes about 6 months of continuous coaching, just a total empirical, anecdotal, nothing based in, no papers we've published on this or anything, but for all this stuff to start clicking, now the habits are solidified. They have like, that willpower. So when the habits aren't working, they can kind of willpower themselves out. We've changed people's routes home using Google Maps, so they bypass like that strip of the Dairy Queen, McDonald's, Taco Bell, so that they're just not tempted. So like those things, and when you start implementing these things with the help of coaches and other experts, start making a difference. So it's funny how there's all these techniques. So that's good news, I think, right? It's like, it's good that we have all these techniques that are able to do this. So that's how kind of we do it. It does start with that understanding what is the reason, like the real reason, like really open up about it. It's okay to just open up about it. And we've had people who are just like, you know, I'm overweight and I'm out of shape, but I have a young son and I want to feel better about being a better mom. So like you get to the bottom of it, I'm like, what does that mean to you? She goes, well, I just don't want him to see that, bad habits and bad behaviors and have him be in the same situation I am with prediabetes in my late 20s. I was like, okay, so you feel guilty as a mom. And that is a really strong motivator. That took time to get to that spot where she was comfortable enough to say that. But then that we had that information, in addition to a couple others with her, we're able to move forward. And then we could start implementing those different techniques in those different buckets.
Yeah. So powerful. And what you've just described is really the essence, the magic of the coaching process.
Yeah.
Well, thank you so much, Dr. Ravi. Where can people find you? Because I know they're going to
Oh,
want to know more.
no problem. So, I'm the CEO and founder of a company called Daytona Health. It's www.daytona.health. Where we do this for a living. If someone was just having trouble knowing where to start, happy to grab a call. But you could always just even before that, you find me on LinkedIn at Ravi Komati Reddy, and you can find me on Twitter at R Komati Reddy. So feel free to just DM me or send me a message, and happy to pick up the phone and just chat and see how we can help or swap notes.
Well, check him out. And he is a big, big supporter of health coaching. So thank you so much for being on Health Coach Talk today.
Thank you for the opportunity, Sandy. Always a pleasure.
Thanks.